Evening, ladies and gentlemen. Thank you so much for coming today to join us for our third annual Southwest Integrated Personalised Care Awards. My name's Frances Tippett, and I've had the privilege of leading the Southwest IPC team for 11, 12 years now. And it's absolutely become the highlight of our year to see the incredible work that is happening in the region when we read through the nominations that come in. And I really hope that you enjoy tonight's celebration as our way of saying thank you to you for the incredible work that you've been leading, innovating, doing day in, day out. I'd like to thank the team that have helped organise tonight. And just to remind you that we are live streaming, because I know there are some people who couldn't attend this evening. And so what would be lovely, if you're all okay with this, is if we could also just get a couple of room photos if everyone's happy. And we've got someone trying to come in. Just so that we can make sure that we do. We can make sure that we promote tonight's occasion and the work that's been happening. We will be doing that via social media, and I hope you're all fine with that. We've put down the tags there. Please do use them, but if I could ask you to perhaps wait until the end of the evening to do so. Because we're using a live stream and this is in a beautiful old building with lots of stone, we don't want to end up overloading the internet availability. Right, Paddy, are we good to do a couple of shots?
Yes.
Is the door misbehaving?
I wasn't sure whether they were still using to...
Right. Okay. I'm sure you'll all agree that the catering team have done an incredible job with super local caterers. I can see some nods. Can we do a round of applause for the catering team? Thank you very much. And we'll get to enjoy some more of their delicious cooking when we have a break partway through tonight's proceedings, where we're going to get some pud as well as a top up on our drinks. Okay. Now I've tempted you with that. What excitement! Right. So, to make sure, because now you all want your pudding, we'd better start actually making the award, shouldn't we? Yes. Right. So, we're going to start tonight's award with the Green Award. And both the highly commended and the winner of this year's Green Award show that by connecting people with green spaces, we can demonstrate the value of the natural world to improving our own health and well-being, as well as strengthening the case for health to invest and broaden its involvement in the green agenda. And this year's highly commended award goes to an organisation that is focused on supporting people to access green spaces. Evidence shows that nature spaces aren't accessed equally by everyone, and people from ethnic minority backgrounds are one of the 4 social groups underrepresented in nature in the UK. Inequality in access to nature exacerbates the health inequalities experienced by these communities, and this year's highly commended winner showcases an energising example of how social prescribing and community-based support can address this. This team, using supportive self-management approaches, have liaised with community groups led by local visibly minority ethnic people such as the Bangladeshi Association, Chinese Elders Club and Alawi to find out what matters to these community members and supported referrals into the Nordic Walk support programmes. This direct community engagement and co-design approach has resulted in referrals from people who are less likely to access the primary care system, helping address the local health inequalities in inner city in East Bristol. The judges were particularly impressed that the self-reported personal wellbeing outcomes showed a 27% increase in happiness and a 53% decrease in anxiety. The Green Award, highly commended, goes to Let's Walk Bristol. Wonderful, thank you. No, well, thank you so much. And your certificate, and if you stand near the X, we can get a quick photo. It's X marks the spot, so we can all look the same. This way, you need to. Okay, this is the first one, this is where everyone can go to that. Are we ready? Okay. Perfect. Thank you so much and enjoy your evening. And I'd now like to invite Richard Schofield, who's NHS England's Southwest Director Lead for Greener NHS, to announce the winner of the Green Award.
Thank you, Francis. Good evening, everybody. And just like to say that as somebody passionate about the net zero agenda, it's really great to see that we've relied entirely on the power of human connection and hot air to heat the room today, rather boring old carbon. So I'll now announce the winner. This year's award winners have made remarkable progress in embedding nature-based care across the organisation's mental health services, transforming how patients engage with their recovery, including creating nature connection opportunities for service users, both in the community and inpatient settings, with participation teams working directly with service user groups. They are the first mental health trust in England to offer training on integrating nature into mental health care, with a wide-reaching community of practice that organised training, provided resources and advocated for the positive impact of nature on patient outcomes. Partnerships were formed with local nature-based organisations such as St Werburgh's and Bath City Farms, offering outreach services including for refugees and CAMHS patients. Additionally, a unique post was developed to support access to allotment sites for patients in recovery and integrated green spaces into the design of new estates, like the Kingfisher unit, further enhancing patient care. The Trust also pioneered funded referral pathways, linking mental health teams to nature-based interventions, ensuring that mental health workers have green care options to offer with confidence. The organisation's leadership have also championed nature-based practice at national conferences, spreading knowledge and promoting the benefits of nature on mental health. With a culture of collaboration and strong leadership across the organisation, nature-based care is deeply embedded in their strategy, training and service offerings, ensuring sustainable, personalised mental health support for all. This holistic approach is not only good for people, but also good for the planet. The winner of the Green Award is Avon and Wiltshire Partnership Mental Health Trust and Matthew Page, Chief Operating Officer, BNSSG.
Who's going to hold it? Oh, we all hold it?
Yeah, go for it.
Thank you. Thank you very much.
Cheers. Thank you very much. Well done.
certificate coming down as well now. So our next award is the Using Our Money Well Award. And the highly commended in this category this personalised care story, including a one-off personal health budget, impressed the judges in showing how a small budget could have a big impact, both on the person and their family, and in reducing the number of times the person accessed GP support. In 2016, Citizen X sought help for their cognitive impairment and was later diagnosed with posterior cortical atrophy dementia. He has shared, "What's important to me is maintaining my independence and dignity, which includes my physical health. As a veteran, I've always been disciplined to keep in good physical condition. Access to a local gym that has made reasonable adjustments for people like me with visual impairment and spatial awareness issues have created an environment which is quiet and spatially safe for me to navigate equipment, with an instructor's guidance helping me to avoid becoming deconditioned. A change in my daily routine relieves my mental health issues of frustration, anxiety, isolation and boredom. I'm afraid of becoming a burden to the wider healthcare system through frequent use of services and reliance on medication. Accessing a social prescribed activity that has made reasonable adjustments to support me using a one-off frailty and dementia personal wellbeing budget managed by Age UK Gloucestershire has helped me avoid physical and mental health deterioration during the past 6 months. I've noticed I'm less reliant on visiting my GP. This GP practice has focused on what matters to the person, worked effectively with them and system partners, reducing pressure on their own service, just as the comprehensive model of personalised care intends. Using Our Money Well, highly commended goes to Dr. Anne Cooper and the Cotswold Medical Practice. I cannot make it today, so Lisa Clare is here to work on her behalf. Thank you, Lisa, and I know that you will make sure that gets taken to them. Well done. And I'd now like to invite Jane Harris, Deputy Director of Nursing for Gloucestershire ICB, to announce the winners of our Using Our Money Well Award.
Good evening, everybody. So this work is an outstanding example of personalised care in action, embracing the what matters to me approach to tailor support for individuals. By truly listening and understanding the unique needs of those they assist, the team builds trusting relationships and ensures that people have choices about the care they receive. This personalised approach empowers individuals, giving them a voice. The impact of this has been felt deeply by those it supports. One individual recently bereaved found solace in having someone to talk to and was encouraged to regain social connections through a local bowls club. Others have spoken about how the project has helped ease feelings of being overwhelmed and provided vital direction in navigating services they wouldn't have been able to access alone. For those facing isolation, the project has been a lifeline, offering guidance, companionship and solutions tailored to their specific circumstances. Professionals working alongside this team also highlight the invaluable role in preventing unnecessary hospital admission and providing creative solutions beyond traditional care pathways. The team's trauma-informed practice, responsiveness and flexibility have been instrumental in supporting individuals at risk of self-neglect, enabling safe and supported hospital discharge and even sourcing resources such as food and appliances. Their swift action in securing home adaptations and funding for a palliative care patient ensured that he could return home with dignity and the support he and his family needed. This project stands out because it fills a crucial gap in community care, offering a level of personalisation and adaptability that traditional services often cannot. By reducing the need for hospital admissions, supporting independent living and providing essential practical assistance, the team is making a tangible difference in people's lives. Their dedication, creativity and compassion ensures that every individual receives the support they need in a way that respects their dignity, preference and independence. The winner of Using Our Money Well Award is Community Flow Team and Compass Southwest in partnership with One Northern Devon.
We'll go this way for the photo, please. Wonderful. Our next award is the Health Equity Award, highly commended. This programme empowers individuals by encouraging them to explore what matters to me and build the confidence and resilience to manage their conditions, symptoms and challenges more effectively. Delivered by a trained facilitator and co-facilitated by someone with lived experience, the programme is designed to foster meaningful peer support, recognising the significant health inequalities and poorer outcomes experienced by people with learning disabilities. Launching a dedicated programme for this group became a priority, working with disability forums and user groups across Devon. The programme development involved a structured process, including engaging facilitators with relevant experience, securing training and resources, and designing accessible marketing materials. The programme was carefully constructed to be accessible, including the use of alternative text descriptions and support from the Torbay Accessible Information Team. Outcome measures, including the WEMWBSID questionnaire, were collected to assess participant well-being before and after the programme. Feedback from participants and facilitators was invaluable, leading to resource adjustments in collaboration with Hope for the Community to better suit the participants' needs. The success of this pilot has paved the way for future iterations, with the next programme being delivered alongside learning disability ambassadors in Torbay. The long-term vision includes training these ambassadors as co-facilitators, ensuring sustainable and community-led support for individuals with learning disabilities. By fostering resilience and self-management in a personalised way, the HOPE programme demonstrates the impact of tailored support on individuals facing health inequalities. This initiative exemplifies the power of collaboration, accessibility and lived experience in delivering meaningful and lasting change. And the highly commended in the Health Equity Award category goes to the Devon Hope Team, Torbay and South Devon Foundation Trust. Thank you for making sure that certificate gets to where it needs to. And I'd now like to invite Helen, who's already racing up here, Helen Davies-Cox, who's the head of Personalised Care for Torbay and South Devon, to announce the winner of the Health Equity Award.
Thank you, Francis. So the adoption of this model to build trusted long-term relationships with residents experiencing high levels of inequality has been inspired by Brazil's successful approach, focusing on understanding residents' needs, improving well-being, and gently introducing public health conversations. Since launching in February 2023, the programme has expanded to 47 community health and wellbeing workers across 8 areas, hosted by 9 voluntary sector organisations. It is funded by the Integrated Care Board's Inequalities Fund until 2029. Focused at a household level, remaining hyper-local, offering universal support and integrating with GP practices, social prescribing teams and local services. These workers are embedded in high deprivation areas, each supporting around 120 households. Unlike traditional referral-based services, they proactively identify residents with unmet needs through door knocking, community events and introducing from peers or professionals. Using health coaching, community health and wellbeing workers empower residents to navigate services, access healthcare and address their primary concerns, including finance, housing, mental health and loneliness. The impact has been profound. The MyCore Wellbeing Outcome Measure shows 90% of engaged residents report improved wellbeing, one of the highest scores recorded. To further support residents, the programme includes 2 levels of discretionary funding, a small enabling fund for immediate needs and a larger one to resource personalised care plans. By breaking down barriers and reducing health inequalities and improving communities, this work is reshaping healthcare from the ground up, showing that proactive community-driven solutions lead to lasting change. And the winner of the Health Equity Award is Cornwall and Isles of Scilly Community Health and Wellbeing Worker Programme, Cornwall and Isles of Scilly, ICB Volunteer Cornwall and Meaningful Measures.
It's okay, don't panic. Take your time.
Who wants it? Thank you very much.
Move over this way so you can all be in shot. Who's going to take the certificate? There we are, brilliant. Thank you.
Okay, well done.
Living in a digital age. And we certainly are, aren't we? Even though sitting in these cloisters, it feels... The highly commended is awarded to a team recognising the need for enhanced veteran support in primary care. This role has encouraged practices to join the RCGP Armed Forces Friendly Practice Accreditation Scheme and supported the Integrated Care Board's accreditation process, successfully achieving bronze accreditation and progressing towards silver status. With a keen focus on digital solutions, they collaborated with partners across the integrated care system to develop a centralised resource hub, leading to a successful implementation of the Gloucestershire Armed Forces Connect app. Now live and widely promoted, this app provides a comprehensive directory of services for veterans, including health, crisis support, family services, employment, housing and peer support. Their dedication has earned national recognition, with the initiative being shortlisted by the Health Service Journal and attracting interest from the National Director of Op Restore, who is exploring how the model can be adopted by other ICBs. This achievement has been made possible through collaboration with key stakeholders, including PCNs, general practices, NHS trusts, local councils, armed forces charities, and NHSE work groups. By standardising resources and establishing self-referral pathways, the initiative has empowered veterans to access care independently and confidently. The impact has been significant, particularly with the introduction of standardised coding in GP health records, improving data sharing through the summary care record and Gloucestershire's shared care record. These enhancements have removed barriers to system integration, ensuring veterans receive timely and appropriate support. Their personalised care work has highlighted the importance of tailored healthcare for veterans, facilitating access to service such as Op Courage, Op Restore, SSAFA, the Royal British Legion and Help for Heroes. This work is making a real and lasting difference, reflecting a strong commitment to improving care for those who have served. The highly commended certificate for living in a digital age goes to Kevin Ganaway-Pitts, Senior Programme Manager for Digital Primary Care. I'd now like to invite my friend and colleague, Chris Labbe, to announce the winner of the Living in a Digital Age Award. Chris has got background in digital work, but many other varied ones too. And we're very lucky that Chris works with us supporting personalised care when he's not doing work in schools, telling his story of being an anti-apartheid campaigner and then working for Nelson Mandela as one of his bodyguards. Chris, would you come forward, please, to announce the winner of a Living in a Digital Age Award?
Thank you, Francis. I'm going to totally go off script. I'm going to get you to do something. If you can you stand? Now, where I come from, we speak Zulu, and we've got a Zulu greeting. And today is all about honoring and seeing people. Because we live in a world, sadly, where people don't seem to be seen. Lots of people are hidden. So when you say the Zulu greeting, you're acknowledging the person next to you. So I'd like you to look to the person on the right and say, Sawubona. And the person, and say it to the person on the left. Now, look at the better looking of the two. I'm joking. Okay, you may say thank you. The Primary Care Network is developing their integrated neighborhood team to enhance patient care through linking proactive and personalized care in a way that impressed the judges. These initiatives are designed to build capacity, improve patient experience, and introduce innovative tools that support a more holistic approach to healthcare. At the heart of this work is the proactive whiteboard, designed to identify and risk profile vulnerable patients, ensuring they receive timely, proactive support. By leveraging data and clinical insights, the surgery can intervene early, preventing health deterioration and reducing the need for crisis care. Understanding that patient-centered care goes beyond medical treatment, the team has also co-designed the What Matters to Me folder and personalized care and support plans, Me at My Best. These resources empower patients to articulate their priorities, goals, and support needs, fostering a truly personalized approach to their health care journey. Recognizing the importance of collaboration, the surgery has worked with partners to co-develop their integrated neighborhood team, a multi-agency approach that connects healthcare professionals, social care providers, and community organizations. By joining the dots, this ensures that patients receive coordinated, seamless support that addresses both their medical and social needs. Community engagement has always been a key focus, with the surgery establishing place-based meaningful activities tailored to the needs of registered patients. These initiatives encourage social connections, mental well-being, and proactive self-care, reinforcing the belief that good health extends beyond clinical settings. By embracing supported self-management tools, enabling individuals to take an active role in their health and well-being, and providing patients with the right tools and resources, the surgery is fostering independence, confidence, and improved health outcomes. This work exemplifies promising practice linking better understanding of data with the personalized care model to improve outcomes for people in developing integrated neighborhood teams. And the winner of the Living in the Digital Age Award is Dr. Sharon Druitt. First on surgery, and Rachel Meadows, Business Manager, North and South Gloucestershire PCN.
For the top. I realise that I put Chris at a significant disadvantage. This lectern is set for the height of someone of me, 5'4", not Chris, 6'4". Now for our first personal recognition award of the evening. This person has been instrumental in improving the experience of patients living with secondary breast cancer through the RESPECT process. Recognising that whilst RESPECT has encouraged broader conversations about care, resuscitation recommendations often dominate discussions, and they sought to create a more personalised approach. Through the development of a future care planning clinic, they and their team introduced what matters to me conversations, ensuring that patients' wishes, priorities and the quality of life remained at the forefront. This nurse-led clinic fostered shared decision-making, working alongside oncology teams, palliative care specialists, Macmillan, Sue Ryder, Maggie's and other system partners. The impact of this initiative has been profound. Patients like Sandy have expressed how their personalised care and support plan enabled them to focus on living well, achieving personal goals and maintaining their quality of life. By integrating services and prioritising meaningful discussions, this person has helped redefine how future care planning is approached for those with life-limiting conditions. Their dedication to person-centred care has strengthened therapeutic relationships, empowered people in decision-making, and modelled integrated, compassionate care. And this personal recognition award goes to Justine Crew and the Oncology Centre team at Gloucestershire Hospitals NHS Foundation. Now, Justine cannot attend, but we understand that she is watching the live stream. So could everyone all together say 1, 2, 3, well done, Justine. 1, 2, 3, well done, Justine. Thank you. So our next award category is the Connecting People Award. And this highly commended award is given to work which, as the World Health Organization states, high-quality social connections are essential to our mental and physical health and our well-being. Social isolation and loneliness are important yet neglected social determinants for people of all ages. WHO estimates that 1 in 4 older people experience social isolation, and between 5 and 15 of adolescents experience loneliness. A large body of research shows that social isolation and loneliness have a serious impact on physical and mental health, quality of life, and longevity. The effect of social isolation and loneliness on mortality is comparable to that of other well-established risk factors such as smoking, obesity, and physical inactivity. Social isolation and loneliness are increasingly being recognised as a priority public health problem and policy issue across all age groups across the whole world. But it is often the small local support initiatives provided by small groups and dedicated individuals that can transform this picture for people. Our Connecting People Highly Commended Award goes to just such a person today. The nomination we received warmed the judges' hearts. It included Trudy always goes above and beyond. She has been coordinating the community group from Stour Connect for a long time. This is a vital service as it allows people to establish and maintain friendships. It is open to people from the local community who otherwise would struggle to meet people due to being ineligible for funding. The group also provides a lot of fun, an opportunity to meet together, share food, play games, and have a lot of fun. The group has recently provided evening discos, as in the process of purchasing a new karaoke machine. So the highly commended to the Connecting People category goes to Trudy Gosney from Stour Connect Hairdressing. Thank you so much. And next year, can you bring the karaoke machine? Have some fun. I'd now like to invite Richard to announce the winner of the Connecting People Award.
Thank you, Francis. And as somebody who's heard Francis sing, please don't bring the karaoke machine. The judges would like you to hear about Meet in the Park, a community-led mental health initiative in memory of Carol Mohan, who tragically died by suicide in June 2023. Her husband Steve set up Moments, a charity to support local mental health initiatives. Wanting to make a meaningful impact, he approached Pioneer Medical Group, where Carol was a patient, to explore how even a small amount of funding could support mental well-being. From this, Meet in the Park was born, a simple yet powerful idea, a welcoming, inclusive space at Blaze Castle, Parkrun, where patients, staff and the community could connect, walk, run, spectate, or simply share coffee and conversation. More than just exercise, it fosters social connections, reduces isolation, and empowers people to take control of their health at their own pace. Led by Pioneer staff, doctors, nurses, care coordinators and social prescribers who volunteer their time, the group removes barriers to participation. Free t-shirts, refreshments, support with transport and footwear, and individual introductions ensure everyone feels welcome, regardless of ability or background. Patients of all ages, including those with physical disabilities, severe anxiety and sensory impairments, have found belonging and purpose in Meet in the Park. This initiative has transformed a moment of loss into a movement of hope, creating a lasting positive impact on mental and physical well-being. It's a real pleasure to announce that the winner of the Connecting People Award is Pioneer Meet in the Park team from the Pioneer Medical Group. Congratulations.
award is Giving Confidence. The highly commended. Some nominations speak so powerfully of the difference that personalised care can make, especially when the nomination comes direct from someone who has benefited. And this year's highly commended for the Giving Confidence Award is just such an example. The judges wanted you to hear the nomination they received for this highly commended team. This team started supporting me in the community at 18 after being discharged from inpatient psychiatric hospital. I was a very poorly young man who had no confidence and was still experiencing mental health struggles, and people didn't know if I would manage to keep myself alive, let alone thrive. Fast forward to this year, they have supported me into finding employment. They have supported me by encouraging me to share my lived experience and supported me to become a lived experience trainer. Fiona is a dedicated care manager. I have never met a professional in an SLT who does so much work with service users. She is dedicated to ensuring that she has a strong relationship with all service users in order to provide the best person-centred care possible. Alan is an amazing trainer who delivers training. He is approachable and trains in a way that isn't boring. He has gone above and beyond his role in supporting and empowering me to deliver expert by experience training. And the highly commended certificate for Giving Confidence goes to Fiona White and Alan Walker from A+ Ability. I'd now like to invite Michelle Schofield, who's the head of personalised care for BNSSG system, should use acronyms, should be Bristol, North Somerset and South Gloucestershire Integrated Care Board.
Thank you, Francis. This year's winner of the Giving Confidence Award is unusual and powerful. It aims to give confidence to staff to think and practice differently, to enable people's wishes to be front and centre of their care. Risking Happiness 2 is an innovative training film co-developed by the University of Gloucestershire and NHS Gloucestershire Integrated Care Board to challenge perceptions of positive risk-taking in healthcare. This unique project brings together healthcare professionals, social care providers, students and creative artists to explore how informed decision-making can enhance patient autonomy and integrated personalised care. Featuring real NHS staff and a wonderfully distinctive papier-mâché puppet named Ted, an 83-year-old patient facing complex health challenges. The film creates an engaging and thought-provoking platform for discussion by illustrating the dilemmas professionals encounter while balancing medical and social needs. The film highlights the importance of collaborative, person-centred approach to risk, using student and staff training as well as workshops across healthcare and voluntary sectors. Risking Happiness 2 is shaping future care by fostering meaningful conversations and innovative solutions. This initiative aligns with the university's Arts, Health and Wellbeing Centre, a pioneering partnership with NHS Gloucestershire ICB that will be physically based at the City campus in Gloucester from 2025. The centre will drive research, practice, innovation and creative interventions to improve health outcomes across all life stages. By embracing storytelling and the arts, this project transforms professional education, empowering healthcare providers to navigate complex decisions with confidence and compassion. It's my absolute pleasure to announce the winner of the Giving Confidence Award, our Healthier Communities and Individual Teams, Hannah Gorf, Senior Programme Manager with Gloucestershire Integrated Care Board. Hannah couldn't make it tonight as she's poorly, so we'd like to invite Emma Savage and the team to collect on her behalf. Congratulations. Yeah. Can we follow the previous trend and do a 1, 2, 3 for Hannah? So we'll say, well done, Hannah, after 1, 2, 3. 1, 2, 3. Well done!
And with the team's agreement, we'll make sure that a link for watching that film is sent out for anyone who'd like to see it. It really is absolutely brilliant. So our next award is the Choice and Control Award. Highly commended. The judges saw this service as one that empowers people with dementia to take control of their lives. Acting as a safety net within the community, the service provides wraparound support, ensuring no one faces dementia alone. By receiving referrals from various sources, dementia advisors go beyond the initial reason for referral, exploring individual needs in depth. Through trust, time, and expert knowledge, they help individuals adjust to life with dementia, focus on what matters most, and plan for the future. This work is delivered through partnership across organisations, including the Alzheimer's Society, Mindsong, the Memory Assessment Service, Gloucestershire Health and Care NHS Foundation Trust, Community Dementia Nurses, the Complex at Home Service, Acute Admiral Nurses, Primary Care Networks, Age UK, Adult Social Care, and many more. Together, these services ensure a joined-up approach that connects individuals with the right support at the right time. Dementia advisors make a real difference by listening, understanding, and advocating for people's choices. Their proactive, ongoing support means individuals feel heard, are able to plan ahead, and remain connected to services as their needs evolve. The impact is profound, preventing crises, reducing duplication, and ensuring a seamless experience for those affected. This work is not only rewarding but essential. By providing personalised, responsive care, dementia advisors help people retain control of their decisions, supporting them before crises arise. Looking ahead, this model of care has the potential to be further embedded across Gloucestershire, creating an equitable, connected system that truly meets the needs of people living with dementia. The commitment to never discharge individuals ensures that support is always available, reinforcing the Dementia Advisor Service as an essential part of integrated dementia care. A highly commended certificate in the Choice and Control category goes to the Alzheimer's Society Dementia Advisor Team, Nicola Evely, Local Service Manager, and Kat Medley, Regional Manager.
Thank you.
And I'd now like to invite Jane to announce the winner of the Choice and Control Award.
This is a service dedicated to empowering individuals eligible for continuing healthcare funding through giving them control over their personal health budgets. By prioritising choice, flexibility and independence, this service enables people with complex health and care needs to live fulfilling lives on their own terms. Rooted in core values of courtesy, respect, effective communication and professionalism, the team is committed to delivering a truly person-centred approach that transforms lives. Combining expert clinical assessment, tailored support planning and dedicated recruitment of personal assistants, this service ensures everybody's care is designed around their unique needs and preferences. The service is commissioned by the Integrated Commissioning Board and provides end-to-end support from initial assessment and PHB setup to ongoing management and training. A key innovation has been the direct support grant pilot, which gained national recognition. The impact of this work is best illustrated by patients like Annie, who, despite living with limb-girdle muscular dystrophy, maintains her independence and an active social and family life thanks to the team of 12 personal assistants. With support from the team, she has shaped a care plan that enables her to fully engage in daily life, including raising her son. Annie's story is just one example of how individuals are empowered to achieve their goals and live their best life. Their dedication to personalisation, collaboration and outcome-focused support makes them worthy of receiving this award. The winner of the Choice and Control Award is Partner to Care, Serona Care and Health CIC.
I'm looking to Sam. Are we ready to open the doors? Because now it's time for a short break. So ready to stampede for the pudding. And there are exits, of course, at both ends. We'll call you back in soon. And for those of you on the live stream, please go and get yourself a cup of tea too. And the highly commended goes to a novel service that's improving engagement and well-being. Recognising the vital role fathers play in family well-being, Dr. Nicol launched an innovative project to support new dads in Somerset. Initially funded with £13,000 from the local maternity and midwifery budget, the project aimed to offer flexible, personalised health coaching to new fathers. While early outreach efforts saw limited uptake, valuable insights from dads shaped a more effective community-driven approach. And in response, the initiative shifted to GP practice-level engagement, ensuring dads heard about the service multiple times from trusted professionals. A comprehensive training programme was developed in collaboration with Somerset Safeguarding and health coaching leaders, equipping 48 professionals, including GPs, public health nurses and Connect Somerset teams with the skills to identify and support fathers' needs. These trained professionals are now formally recognised as new dad supporters across 40% of GP practices and 10 out of the 12 PCNs in Somerset. Looking ahead, the project aims to expand training to key employers, sports clubs and community groups while launching a wider media campaign. And the long-term vision is to embed support for dads as a routine part of antenatal and postnatal care. This groundbreaking work is already changing perceptions and improving access to vital support, ensuring new dads feel valued, heard and empowered. The highly commended certificate in Seeing Me category is awarded to new dad supporters, Somerset NHS Integrated Care Board in association with Somerset Activity and Sports Partnership.
Thank you.
And I'd now like to invite Helen to announce the winner of the Seeing Me Award. The irony, Helen, that for the Seeing Me Award, you're actually I've enjoyed this.
The irony is not lost. So the organisation has had the ambition to transform the community mental health it provides with its Your Team, Your Conversation, Your Plan model, placing personalisation and collaboration at its core. This innovative approach moves beyond the traditional care programme approach to focus on what truly matters to individuals, ensuring their voices, strengths and needs shape their care. By fostering trusting relationships, the model supports people in achieving meaningful outcomes through a dynamic and co-produced personal wellbeing plan. This plan is developed with the individual and the network, owned by them and can be reviewed when it suits them, ensuring flexibility and autonomy while also being stored as an electronic record for system-wide integration. This model was built through extensive collaboration with 21 workshops bringing together people with lived experience, carers, AWP staff, voluntary sector organisations, local authorities and primary care networks. From the outset, co-production was central with people with lived experience, leading discussions and shaping every stage, from designing care plans to developing training materials and informational resources. The model's foundation rests on quality pillars of relationships, reflection and communication, ensuring care is trauma-informed, proportionate and transparent in managing risk. A significant innovation is the integration of patient-reported outcomes and experience measures, ensuring that care evolves based on real feedback. The approach meets all 5 criteria set out by NHS England for personalised care and support planning, reinforcing its commitment to high quality, individualised and co-produced mental health care. By shifting to a more flexible and person-centred system, the judges believe that AWP has not only enhanced the experience of those accessing services, but has also set a new standard for collaborative community-based mental health support. And the winner of the Seeing Me Award is AWP, Your Team, Your Conversation, Your Plan with BNSSG. Lots of you. Come on in. Come on in.
Did he get everyone in, did he?
No, man.
It's now time to give the second Personal Recognition Award of the evening. For the past 5 years, this person has been at the forefront of transforming health and social care in Somerset. She played a key role in developing a bespoke joint quality assurance framework, QOF, setting measurable standards for care providers. Over the last 2 years, she's expanded partnerships and introduced specialist support pathways, ensuring that when a provider struggles with a key performance indicator, targeted expertise is available to improve outcomes. Her unique approach lies in her ability to turn data into personal action. She recognises that behind every statistic is a real person, and by making this personal, she brings together professionals across the system to drive meaningful change. And her commitment to collaboration, innovation and prevention has directly improved care quality while reducing system pressures. Notable successes include reducing tissue damage in care settings by partnering with the tissue viability team to deliver training, leading to improved patient outcomes in 13 out of 16 providers, preventing choking incidents by working with speech and language therapists through both provider training and individual patient reassessments. Through perseverance and a deep understanding of system challenges, she has not only improved quality of life for individuals, but also created a more efficient joined-up health and social care system, proving that when we all work together, we can achieve better care for all. And our second personal recognition award of the evening goes to Natalie Ledley, registered nurse working at NHS Somerset. Collaborative working, highly commended. 18 years has been dedicated to reducing health inequalities for people with learning disabilities by the person highly commended this year for his collaborative working. His passion is evident in his leadership of the One Gloss Big Health Day. This annual event is a shining example of collaboration, bringing together health and social care, emergency services, voluntary organisations and people with lived experience to promote inclusive health and well-being. Focused on the whole person, the event encourages staying active, socialising and having fun, while raising awareness and community-based support. Each year, this person and his team meticulously plan the event, mapping stakeholders, securing funding, and coordinating volunteers to ensure a seamless and impactful experience. The event has grown into a powerful network, where stallholders and sports providers return annually, inspired by the connections and positive changes it fosters. Attendees leave not only with it valuable health information, but also with a sense of empowerment, having engaged with inclusive activities and found support tailored to their needs. The judges could see the commitment to co-production and personalised care at the heart of this initiative. By creating a space where people are heard, choices are valued and well-being is prioritised, this event is driving real change. This person's work strengthens collaborative networks and demonstrates how health and care can be more inclusive and person-centred. To sustain and grow this impact, ongoing support is essential through funding, accessible venues and resources that enable more people to benefit. Simon's vision and dedication continue to inspire, making a meaningful difference to the lives of so many. The Collaborative Working Award, highly commended, goes to Simon Chorrocks, a strategic health facilitator for learning disabilities, the Gloucester Health and Care NHS Foundation. Wonderful. Okay. And now for the winner of the Collaborative Working Award. In November 2023, collaboration between the Urology, Palliative Care and NHS at Home teams led to a pioneering approach in patient care. Historically, continuous bladder irrigation was only provided in hospitals due to the need for constant monitoring and intervention. However, with dedicated and innovative thinking, the teams worked together to make it possible for selected patients to receive this care at home. One such patient, a 91-year-old gentleman with bladder cancer, was admitted with sepsis and clot retention. Following discussions with him and his wife, it was agreed that further interventions to stop the bleeding were not appropriate. His one wish was to return home for his final days, and his wife was determined to support him in doing so. To enable this to happen, rapid training was completed and the NHS at Home team stepped up, providing irrigation support 3 times a day alongside district nurses and ongoing guidance from the hospital's urology and palliative care teams. Thanks to the dedication, compassion and determination of everyone involved, this gentleman was able to spend his final week at home as he wished to do, passing away peacefully with his wife by his side. Without this determination to collaborate from this NHS at Home team, with all the clinical teams involved in this gentleman's care, it is likely that he would have died in hospital. This initiative not only honoured this couple's wishes, but it's also set a precedent for what is possible in end-of-life care, demonstrating the true power of teamwork, innovation, and person-centred care. And we recognise that this was just one case study of the incredible work this team is doing. The Collaborative Working Award winner is Bristol North Somerset and South Gloucestershire NHS at Home team. Excellent. Superb. Many congratulations. Thank you. Working together differently. This team is highly commended. The Specialist Palliative Care Service has focused its approach on fostering collaboration to enhance patient care. Since the pandemic, the team has adapted to increasing referrals and patient complexity by implementing innovative solutions. The team developed an electronic patient record and established data sharing agreements with Gloucestershire Health and Care NHS Foundation Trust, with the intention to provide seamless person-centred care. The judges could see from Elle's story that a coordinated, personalised approach enabled her to make informed decisions about her treatment, including medication choices. Prioritising her wishes and integrating support from multiple healthcare teams, the service provided holistic, compassionate care tailored to her complex needs. To improve efficiency in clinical decision-making, daily virtual clinical review meetings were introduced, allowing for real-time discussions of new referrals and complex cases. This initiative has significantly enhanced patient oversight, with 2,333 patient episodes reviewed in 2024 alone. Their work not only benefits patients but also empowers staff, fostering job satisfaction and reinforcing the values of palliative care. Moving forward, this team aims to build on this success by evolving clinical review meetings into a sustainable virtual wall model and investing in workforce development to support personalised care. With 10% of all deaths in Gloucestershire involving them, the team is also committed to expand research and innovation to better serve patients with non-malignant conditions. By continuing to work collaboratively, they strive to ensure the highest quality care for those facing complex and challenging journeys. The highly commended goes to Samantha White, Clinical Lead, and the Specialist Palliative Care Service at Gloucestershire Hospital's NHS Foundation Trust.
Thank you.
Now I'd like Richard to announce the winner of the Working Together Differently Award.
Thank you, Francis. An innovative collaboration in transforming the way mental health patients are supported when they reach out to emergency services. With around 15% of 999 calls relating to mental health, paramedics and specialist teams identified a recurring issue. People frequently found themselves caught in a cycle of crisis with no clear pathway to long-term support. Recognising this gap, a partnership was formed to create a new referral pathway connecting people in distress with recovery navigation services. This initiative brought together paramedics, mental health practitioners, recovery navigators and community experts, fostering a culture of collaboration. By working across traditional silos, the team developed a process where mental health practitioners within the 999 111 system could identify people in need of further support. Once identified, these individuals were contacted for a follow-up conversation and introduced to a recovery navigator who guided them through their journey towards stability and long-term recovery. The navigator facilitated a personalised, what matters to me conversation, helping people articulate their needs and wishes and access appropriate community resources to support their well-being. Developing this pathway was not without challenges. Integrating different emergency services and recovery navigation systems required significant effort, particularly around data sharing, confidentiality, and embedding changes within a fast-paced operational environment. The co-design process took time, as multiple stakeholders worked to build a programme that truly belonged to everyone involved. The judges perceived that it was because of this commitment to co-design that the project has been embraced by both professionals and people, demonstrating the power of collaboration in reshaping mental health crisis care. The current focus is to secure long-term funding to embed this service as standard practice. The team is highlighting the project's impact on personalised care and community mental health outcomes to commissioners. By ensuring that people receive the right support at the right time, this initiative is breaking the cycle of crisis, reducing pressure on emergency services and improving lives. The winner of the Working Together Differently Award is Recovery Navigation for 999 111 Project Team, Integrated Access Partnership for Mental Health.
I'm delighted to present the third Personal Recognition Award of the evening. Young people leaving care face significant barriers to education, employment and health, with 41% of care leavers aged 19 to 21 classified as not in education, employment and training, compared to the national average of 11.6%. Only 2% enter apprenticeships and 70% are at a risk of premature death. Understanding these urgent challenges, this person has championed collaborative, system-wide solutions to break down barriers and offer meaningful pathways to health for care leavers. This person has been a driving force behind the Care Leavers programme, an initiative mobilised across Bristol, North Somerset and South Gloucestershire Integrated Care Board to improve access to career and healthcare support for young people living in the care system. His unwavering commitment to advocacy has brought together trust, general practice, primary care, community care DWP, 3 local authorities, Career Matters and numerous professionals to create real opportunities for care experienced people. Under his leadership, the Integrated Care Board achieved the Lived Experience Charter Award in 2024 for this work, demonstrating the deep commitment to co-production with those directly impacted. His vision and dedication exemplify the power of partnership working to drive real change. His colleague told us that the project provides such value for the health and employment opportunities and outcomes for some of our most vulnerable children, young people and adults in society. It also provides an opportunity for integrated systems to work in a multi-agency approach, share good practice and provide career opportunities and jobs. Simon Bone is an outstanding leader, a tireless advocate and a true change maker. He's highly deserving of this award. And so our third Personal Recognition Award goes to Simon Bone for the Care Leavers Project in France. And now we have the Shared Decision Making Award. And I'd like to invite Chris to announce the winner of this.
The judges heard how a musculoskeletal MSK physiotherapy service look an innovative approach to tackling health inequalities by hosting the first community appointment day at Victoria Park Community Centre in Bridgewater, an area with high MSK demand, long waiting lists and significant deprivation aimed at bridging gaps in MSK care. This event brought together MSK physiotherapists, Somerset Activity Sports Partnership, Age UK, and other community partners to provide holistic, patient-centered care. People from MSK waiting list were invited for on-the-spot assessments, personalised rehabilitations, plans, and access to local health and well-being resources. Each attendee received a health passport to document key takeaways from exercise guidance to safety netting advice. The focus was on what matters most to patients, ensuring shared decision-making was at the heart of every interaction. 130 people attended, with 98% saying they would recommend coming along to the community appointments day to others, and only 27% requiring further intervention, demonstrating the event's success in promoting self-management. This innovative community-driven model is set to expand across Somerset in 2025 as part of the team's commitment to reducing health inequalities and improving MSK care. The Shared Decision Making Award goes to MSK Physiotherapy Team, Somerset NHS FT. And Somerset Active Sports Partnership. better.
And now we move to our final award of the evening. The What Matters Award, highly commended. This service is committed to delivering a universal personalised care approach with a strong emphasis on social prescribing and meaningful activity. In partnership with the Aging Well team, this service provides music therapy for individuals living with advanced dementia or dementia with complex symptoms, offering sessions in their own homes alongside family members. Commissioned by the Area's Integrated Care Board, this service is delivered at no cost to participants, ensuring accessibility for all. And each year, approximately 120 referrals are received, and the service supports around 95 families through a team of 16 qualified music therapists, providing county-wide coverage. Collaboration is central to their approach. The organisation works closely with the Glos NHS Aging Well team, Managing Memory Service, GHC Community Dementia Team, Primary Care Social Prescriber Link Workers, and organisations such as the Alzheimer's Society, Gloucestershire Carers Hub, and AGK Glos. By working not only with individuals living with dementia, but also with their families, this team empowers caregivers to use music as a tool to enhance daily care and well-being beyond therapy sessions. Through 12 weeks of music therapy, families identify challenging moments in their daily routines and develop personalised musical strategies to bring comfort, connection and calm. The impact of music therapy is significant. For Heather, who lives with Parkinson's and low-body dementia, music became a lifeline. She experienced poor mobility, heightened anxiety, and distressing hallucinations. But through therapy, she gained control over her movements and found a way to dispel frightening visions. Her husband now uses music daily to bring her comfort, and during the hospital admission, music helped to bring her back from an unresponsive state. Stories like Heather's demonstrate the transformative power music can play as part of personalised care. We've heard how Mindsong uses music to support and connect with people throughout their journey with dementia, right through to the end of life, ensuring that every person and their family are truly heard and supported. The What Matters Highly Commended Award goes to Mindsong, I'd now like to invite Michelle to announce the winner of the What Matters Award.
Thank you, Francis. The judges heard that this service came from the Trust's commitment to personalising cancer care to ensure people and carers received the support they needed throughout their journey. A review of the service identified the oncology outpatient department as a critical touchpoint, where people often experience some of their most challenging moments. To address the need for additional support, Cancer Services piloted an initiative by placing a cancer support worker in the department. With training in personalised care and health coaching, this worker welcomed patients, provided emotional support and introduced them to key resources such as the Lodge and My Sunrise app. Many people were previously unaware of these resources or unsure of how to use them, and proactive engagement helped them better navigate their care. The pilot received overwhelming positive feedback from people and their families. leading to the exploration of sustainable ways to continue and expand the initiative. Due to financial constraints, funding a permanent role was not possible. So an oncology buddy volunteer role was developed in collaboration with the volunteer service. After recruitment challenges, 6 candidates committed to the role. They received a comprehensive training programme, which includes personalised health coaching, service orientation and guidance from the original cancer support worker. Volunteers will be supported on an ongoing basis by a clinical supervisor. The initiative highlights the importance of collaboration across healthcare teams, operational support and volunteering services in improving patient experience. By embedding personalised conversations into the cancer treatment pathway, individuals are supported and empowered through their care. The winner of the What Matters Award is Oncology Buddy Service, Julie Eason, Torbay and South Devon NHS.
Good catch.
Thank you, everyone, for coming and sharing this evening. When I think back at the years of work that's gone into the work that we've heard about this evening, I go away, and I hope you do too, both inspired and filled with hope and energy for what is possible when people decide we are going to make this change happen for people. And it's through that network and collaboration, it's a theme we've heard today again and again and again, that's what makes it possible. And I'm wondering, what would it be like if we were all energizing each other on a more regular basis, about building that social movement for change through connecting with one another as people who are making change happen, rooted in the values of care and being passionate about making a difference for people in our community. Because the amount of wisdom and energy and passion and commitment and dedication in this room is a really, really powerful thing. And if we can connect together, what might be possible over the next few years? When I first got involved in this work, 12 years ago now, when I think about what has happened since then, and I know there are many people who've been involved in the personalised care journey for years and years and years before that, how much change we've achieved. And now we see this work as being embedded in national policy, and when we can see the challenges that face our health and care system, all the things we hear about again and again, you know, the challenging of resources, the ageing population, the increasing acuity, actually, it's this work that stands the test of time and shows again and again and again that we can make the difference. We can create a positive future for our health and care service, that we can create the kind of support that we'd all want for us and the people we love. And you are demonstrating that through all the stories we've heard today, and I thank you from the bottom of my heart for your dedication and time. I hope you've enjoyed today sharing this companionship with one another, and I'd ask you to think about how to network. Who have you seen today who you haven't seen in a while, or struck up a conversation with? Find them on LinkedIn. We're all on LinkedIn, aren't we? Is everyone on LinkedIn?
No.
No? Well, we can help you find a way. You know, find each other up. Click on it. Send a connect button. I'd love it if all of you connected with me. And then let's think about how we can have conversations, how we can perhaps make these not just an annual event, but have opportunities to connect and stay in touch and create communities of practice so that we can share the learning with each other, because that's how we can really build acceleration and momentum. And also, as we've had today, have a laugh with people who we know share the same view of the world as we do. That things are possible, that things are hopeful, and that we care so much about making a difference. I hope you've enjoyed this evening, this lovely, if somewhat chilly, surroundings, and that you have a very safe journey home. We understand that there was an incident earlier on the road between Wells and Glastonbury, so it might be worth just checking your sat navs before you head off, but hopefully that is now cleared. It's been, I hope those of you watching online have got a sense of the warmth of spirit, if not the temperature in the room.